Okay, hello, everybody. Thank you for coming to this talk from the Professor Amir Pakpour. Okay. Hello, Amir. Can you hear me?
Hello, Dr. Lin. Chong-Ying.
Yes, great. Okay, so I think we have most of our students here. So I think we can start this talk. So before I invite you, I will give an introduction about you. Okay. So Amir, he is my good friend and my long-term collaborator. And I believe that I will collaborate with him for a very, very long time. And from my past collaboration with Emma, I found that he is very talented in research. And one of it is the systematic review and meta-analysis. I'm so fortunate that I can work with Emma to do the systematic review and the meta-analysis. He and his team did a very good job. So I have worked with him to publish some prestigious journals, including like Sleep Medicine Review, Clinical Nutrition, and recently we have published the COVID-19 sleep insomnia systematic review in the eClinic Medicine in the Lancet series. So I believe that Professor Amir Pakpour is a good scholar that can give us the knowledge and information regarding how to do the systematic review and meta-analysis. And I believe his talk today will give you fruitful experience. And then maybe after this talk, you have some idea about systematic review and meta-analysis. And then you may try to do it by yourself. And Amir has provided me the PowerPoint. He's very, generous. He has sent me the PowerPoint, and I will send the PowerPoint to my teaching assistant later. And then all our students will have the chance to have a look at his PowerPoint. His PowerPoint is very, very detailed, 100-something slides. But of course, I think today he will not go through all the 100-something slides, but I believe he will give you very impressive talk. And I think that is very great that we have the chance to invite him. And I think that you all know about, maybe most of you know about the function of the WebEx. So we can have some emoji. And so if you are familiar with this, then you can try to use the emoji. If you're not that familiar with, then please look at the bottom of your WebEx. And then you can see the face icon there. And when you go to choose that face icon, you can see a lot of emoji. And you can do it to share your emotions, to share your thinking. Okay? So I think I'm not going to waste your time. And please now let's give a big hand to Professor Amir Pakpour for his talk today. Now it's your turn, Amir.
Thank you so much, Chong-Ying, for very kind words. Of course, it has been my great pleasure to work with you. And I do hope that we can collaborate for a long-term period. And I believe that we can do that. And also, hello, everyone. Hope you are all doing well in Taiwan. And hope this session will be fruitful for all of you. As Dr. Lin said, that we have been a main collaborator together and we have done some studies. And from my perspective, performing a systematic review and meta-analysis is an important step. Sometimes we can do it from the beginning to understand which factors needed to develop the intervention and what is the association between. So this could be at the end as well Also, when you done so many study and you want to see that what is the real effect and the real association. So this could be known that systematic reviews needed a lot of works and needed a great review team and great advisor group to do that. Anyway, I have lots of slides for you, but of course it's not possible to talk about all of them for now, but I think that this will be good for you to keep it as a guidance and as a guidebook, because I try to summarize all of the steps needed for doing a systematic review so you can use it. And also I will refer you to some guidebook as well to help you if you want to know more. Anyway, I will discuss about why systematic review are needed, the aim of the systematic reviews, when systematic review are useful, who can conduct systematic review, differences between secondary and primary study, different type of reviews, and different type of classics, systematic review, and main step to conduct systematic review. But please note that you can always ask question and I can help you to clarify. Don't think that it's just only a one-way work and the session. I would prefer to have a two-way session, and if you have some questions, some comments, would be very happy to hear, and then we can sometimes discuss about it. Anyway, let's start about the systematic review. Why systematic review is needed? You know that the primary purpose of systematic review is to improve decision. You want to see that what is the effect and what is the association. For example, we have several research databases around, they have published around 100 million papers from the beginning, at least. So you cannot be so easy to see that what is the real effect. With the help of systematic review, you can receive a good support and you can have a clear picture of the outcome you are searching for. So systematic review can help, of course, not us, but also policymakers and clinicians to understand about some association and some intervention effects to make a decision for the patient, for the people, for the law, for the general population. And of course, clinician and policymaker, lack of time and skill to retrieve all of the relevant literature and try to apprise them and synthesize them. So with the help of systematic review, we can do this job, and it will help us to understand in depth about the current literature and could be updated. And then using systematic review can shape us as an evidence-based medicine. So systematic review can be a way to be updated across literature. And without a systematic review, decision would be based on some papers and subset of publication, not a whole picture of publication, because it could be personal view. And sometimes if I want to use a drug for patients, I can go to some RCTs and say that, okay, it's effective, so I can prescribe it. But if I use systematic review, I will understand what exactly the effect of the drug, for example. COVID-19 has done a lot of systematic review and meta-analysis. So with the help of systematic review, we have found that, for example, so many drugs are not effective. But from the beginning, some 1 or 2 RCT showed effectiveness. So based on this, we cannot prescribe the given drug to the patient, because systematic review shows us no effect. So using systematic review will help to make treatment decision, clinical decision, write a clinical guideline, of course, and research agenda. Why systematic review are needed? This is a very important question. The first reason is that we have very much and several papers around the world published across databases. So we are not sure that how much it has published and how many similar topics on across the literature. So we need to do that. So the first reason is to summarize literature. Of course, this literature have published before, and they could have lots of limitation and sometimes methodologically flawed. So because they, for example, they are not RCT, a real RCT, non-RCT, and they have reported maybe wrong interpretation. So I mean, based on the systematic review, we can summarize papers. And the second thing is that based on the systematic review, we can came to a decision and conclusion, and we can understand that how can categorize the outcome, how can combine them, how can report them. So it's always important. But of course, it's not easy. Sometimes there is not too many papers. There is not so much studies on it. Also, it's very narrow, and also so many controversial studies. For example, one positive and one negatives. So we cannot combine them and report them, and we have to be qualitative rather than quantitative and reporting. Anyway, it's important to know that why we needed systematic review. It's not only for a paper, it's needed for decision making. So with the help of systematic review, we can identify relevant studies, evaluate them, evaluate based on their quality, result, interpretation, limitation, and summarize them and report them. So this will help for decision maker, as I told you, could be policy makers, could be clinicians, to have a more accessibility to updated evidences and use it in the best way. When systematic review are useful, then we can conduct a systematic review. First, we need studies for doing a systematic reviews. But which studies is most important for us? All of the studies could be important, but when studies are reported low sample size, in that case, we are not still sure about the effectiveness, then we can combine similar studies and increase the sample size, combine sample size, or pooled sample size, we call it. Then we can increase the strength and the power of the study to report the effectiveness. And also primary studies with controversial results. As I told you before, controversial result could be positive or negative, and you are not still sure that which way and which drug or which intervention could be effective. In that case, you can do a systematic review to have a definite conclusion to proceed with your intervention or not. So I will talk about primary and secondary study and differences, don't worry. So please just only keep in your mind, we have two studies for systematic review, primary and secondary. Of course, we can have tertiary studies as well. Anyway, Some primary studies in system to be used for the systematic review have a considerable bias. So in the bias, we have error. So we are not still sure about interpretation. Anyway, we need to do a systematic review to decrease the bias and to combine them to see how we can use these publications. And another justification for doing a systematic review is when we search, we cannot find high quality systematic review. Of course, for assessment systematic review, we need a good knowledge, but for now, you can have a checklist to assess quality of systematic review. Then if you think that it's not high quality, then you can start with your own systematic review to contribute to the literature and fill the gap. And sometimes there is no any systematic review in your topic and in your issue and your problem, then you can use for your own systematic review. But from my perspective, there are always some systematic review in your field, but it depends if they are high quality, if they are updated. From my perspective, every 3 years, we need a new systematic review on topic. It's important. For example, now, if a systematic review published 2018, we can repeat it 2021 or 22. In that case, we can increase the number of the publications, and also maybe we can increase the quality of a systematic review. So with systematic review, we can have explicit, specified, and reproducible methods. It's important sometimes when you cannot adhere to a good guideline and scientific design, you cannot publish it, because reviewers always ask you about details, and details is important for doing again by them. I can say one of my experience, one of my first experience was trying to publish a systematic review. A reviewer asked me to repeat it, and a reviewer asked me that when I searched like you, I didn't find the exact result like you. So what's the main problem? And I described to the reviewer the exact time frame and range time frame. So it was solved. I mean, we need a very clear question, specific goals, way, and also a good method to be reproducible for the systematic review. And then we can have a reliable result. And in that case, the result will be very powerful and could be reported in a good way. So what will be outcomes of the systematic reviews? The systematic review will have, of course, effective, prevalence, descriptive, association, effectiveness of intervention, and all of them needed a gap. I mean, when we report a systematic review, we are trying to fill gap across the knowledge. Otherwise, it will be repetitive and we cannot publish our systematic review in a good way. And of course, our systematic review won't be used for policymaker, decision makers, so it won't be a useful thing. So who can conduct systematic review? All of us, we can conduct systematic review, but it's important to know that. First, we need to know the methodology. Second, we need to be expert in our field. For example, if we want to do a systematic review for physical activity, we should know about this physical activity in a good and in a detail, and updated about papers in our specific area. Then we can work on systematic review. So no matter who we are, but it's important to have these two eligibility to do and conduct systematic review. And it's important to know that in the systematic review, it's not always try to say effectiveness. It's also always its opposite as well. It's sometimes say that this intervention doesn't work. Please don't use it. So from my perspective, sometimes systematic review try to say what not to do. So this is more important. So if you find a negative association, a negative effectiveness, a negative outcome, don't be afraid. Please report it in a good way, and it will be very good for implementation and for the policymakers and decision makers. Regarding the strengths and quality of studies, systematic review in pyramid is the toughest one. And you can see that we can start from expert opinion. Expert opinion is very low, and it's just only one scientist can report some things, but based on personal view. And we have case series, case report. It will be the third one, observational studies, and then will be non-randomized RCTs, and then RCTs, and finally systematic review. Of course, after systematic review, we have a meta-analysis, but meta-analysis comes from systematic review. It's like quality synthesis and quantitative synthesis of systematic review. I really suggest you to, if you want to read the books and references, you have 10 books. But for me, this is most important books and guidebooks for use, and it has reported very good lines. It's a free PDF, and you can use for systematic review from York University, and also for Cochrane. Databases, Cochrane database is international British charitable organization that use evidence-based medicine for clinicians to decide update. So they have also worked on systematic review. They have lots of groups, around 40 groups in so many areas and around the world, and you can also join them and try to understand, also be in a group and do systematic review with them. So they have also their own guideline, and also they have their own software for meta-analysis. For now, we can start for types of studies. As I told you, when we want to do a systematic review, we start with primary studies. Primary studies, the first-hand studies, and they can be observational and informational studies, and we have a good contact with the target population. I mean, the patient, general population, and etc. But in the secondary studies, they are just only review, and they are just only publications, and it's a second-hand study, I would call it, and they could be narrative review. I will talk about the differences between narrative review and systematic review, but we have several types of reviews, and you can use and you can compare it from here. I can report it, and you can use it from this website to see that what is the differences between so many types of reviews. But two most important reviews could be narrative review and systematic review. Anyway, if I want to compare primary and secondary review, primary review is self-conducted, needs money, needs a budget. Of course, we should have a clear plan. It's the same for the secondary, for clear plan, but we don't have a self-condition, and it's conducted by others, just only publication. It's a cheap, of course, quicker than primary. But it doesn't say that it's quick. It's quick mean that you can do it maybe 1 year, or But for the primary, it takes maybe more time. It depends. But both of them can provide us a very good questions. But secondary analysis and secondary studies help us to understand more and categorize and combine and mix primary studies to be more clearer. And also, of course, lots of differences between them are still lacking. Anyway, for me, it's important to mention that based on our experiences and so many publications, just only 1/3 of data normally published. So it is one of the limitations, but this is still important to know that result of the primary studies, just only 1/3. More than 70 of them are not published, and of course it takes much time to publish primary studies, maybe more than 2 years, and then it's always needed to be updated more. So you have lots of review, secondary studies, narrative review, systematic review, and so other types of review like emerging. But as I told you, I can leave it for you to read it. But please keep in mind that systematic review is the most powerful secondary studies, and they are the most important with the very high confidence. Because in the narrative review, I will show you that narrative review is not systematically searched, and it's based on experience and familiar with the authors and researchers, and you cannot always count on it. And it's like a book for narrative review. And narrative literature review, it's describe and discuss the state of the science of a specific topic from a theoretical and contextual point of view. So it's like a book for several chapters, starting from the epidemiology to treatment, and you always should be careful because it's not a whole picture of the phenomenon issue, or even just only some additive information, because search is not systematic, and it's not, because in the systematic review we need not only a well-defined research question, but also we need at least to search 5 databases, for example, Medline, Scopus, Ovid, Web of Science, and also another databases. And it's important to make sure that we are up to date about all procedures. And after searching, we need to screen them to find the relevant study and measure the quality of the studies, and then synthesize them. But we don't do anything like this in the narrative review. So narrative review is not that powerful study. Example, melanoma treatment in review. It's just a narrative review, or breast cancer treatment, just only a narrative review, but maybe important, but not that powerful like systematic review. These are systematic review, prevalence of burnout among physicians, systematic review. And also health benefit of physical activity, systematic review of current systematic review. We have another type of studies, we call it tertiary studies. Tertiary studies review systematic review. It's like another systematic review for systematic review. If you have lots of systematic review in the same topic, you can systematically review them again and to categorize them in a good way. So they call it tertiary review. So I imported them here. So in systematic review, we have two important column. First, comprehensive search. As I told you, it should be 5 databases. The most and well-known databases should be Medline, PubMed, Scopus, Web of Science could be included, or maybe PsychoInfo sometimes, or it depends on your topic, of course. And also the time is also important here. We should be updated from the appearing of the phenomenon from the beginning, or maybe it should be the start of definition of the phenomenon until now. And the second column is critical appraisal. You should screen them, assess them, appraise them, and have an inclusion or exclusion criteria and measure the quality and then report them. So this both is the most important approach for doing a systematic review. When we want to start a systematic review, we should know that we have 3 steps. First, we should make sure that is a review required or not. If it is not required, we are trying to invent wheel again. So it's nothing and it's not worse. So before conducting a systematic review, we should make sure. It's very important here, and you should start thinking and searching. First of all, you should go for ongoing review. Sometimes you know that we have several websites for this. We have lots of databases. The most important databases is Prospero. And Prospero is from York University. It's a places for registration, systematic review, and also maybe OSF. We have a database of abstract of review effects, Cochrane database of systematic review, National Institute for Health and Clinical Excellence, Campbell Library of Systematic Review, Evidence for Policy and Practice Information, and PubMed. But in the Prospero, you can find ongoing systematic review, but it's not published still, and it's not even submitted. But you can find the protocol, the outcome, and it will be interesting. I'm not sure that if maybe I can show you one of them for you, and it will be good to share. Maybe. Oh, you can see that. Can you see this? No. Yeah. As you can see, this is one of the report from systematic review we have done before. Only my team. It's internet addiction and sleep. We reported. We provided. It's like a proposal for doing a systematic review, and it should be reported because it's needed to prevent from repeated work. So we did it. We started from a clear question. It's important. It could be answerable. Is internet addiction associated with a sleep disorder? We had to report our search strategy, which databases we want to go through it, and which type of the study is important, for example, observational studies, in which languages we want to go through, and which type of a study should be measured and assessed, like a peer review study just only. And what is the inclusion exclusion criteria, and how we can find 2 issues. It's very important question. Internet addiction and sleep disorder. It's very important because if you cannot define these 2 important things, then your systematic review won't be good enough for publication. And then you need to specify population and participant. If you have a age limitation, if you have any phase control study, and what is the main outcome, and how you measure the outcome, and how you extract the data, how you extract the risk of bias, and you should provide a search syntax for each databases, at least for 2 or 3 databases, and you should have a contact for detail if, for example, you want to do something similar, but you are not sure that it's 100 similar or maybe not that similar. So this is a Pakpour, and you can go for it and search, and it has a good resources for doing for doing a good understandable resources for you to understand how you can find a current evidence-based systematic review, and then you can start your own systematic review. This is very important step. Otherwise, you cannot be successful. And it's always good to make sure about the current project. But of course, you can also check about public systematic review. For example, in the PubMed, you can search with the same syntax, systematic and SB, and you can check if there is any systematic review on your topic or not. For example, you can see internet addiction and systematic SB. Then you can find in the PubMed how many systematic review already available and how much your questions for systematic review will answer based on your own systematic review. So you can identify and determine if it's needed or not. But imagine that there are some similar systematic reviews. So you need to criticize and measure your own systematic review. In that case, it will be very good if you can provide a high quality systematic review. Then you should know about what is the high quality systematic review criteria. For a good systematic review, we need a very good, well-defined question about we need to have a very good and appropriate method, comprehensive search, clear criteria for a study population, and inclusion and exclusion criteria, and if they have used a broad and extensive extraction and synthesizing data, and if they reported unbiased and reproducible and transparent way of data. For this, we have a checklist, for example. You can use it. We have lots of checklists, but for me, OnStar could be a good checklist for using it. It's a critical appraisal for systematic review for both randomized or non-randomized clinical trials. So you can click on this web and you can see and find this checklist for assess the quality of reporting systematic review. Then you can make sure that if the published systematic review is good enough or not. But of course, sometimes it depends on the time as well. For example, if the systematic review also published in 2016, then you are now sure that it's needed for another systematic review, and then you can add something more than it. So the first question is added and is answered now. Now we know that why we needed a systematic review, and if everything is okay, we can proceed with the systematic review. For the systematic review, we need 2 important tasks. First, we need to establish a review team. A review team is those will work beside you. I mean, those who are expert in systematic review, expert in methodology, expert in information retrieval, because you know that sometimes we need to write a syntax for example, PubMed, Scopus, and it is not that simple, and of course it's not that tough. You just need to know how you can search, of course, advanced search from PubMed, Medline, Scopus, Web of Science, and how you can use your own keyword on it. So you need information from information retrieval expertise, but sometimes librarians can help you. Some university, like my own university, we have someone like this, and we can ask him or her to help us to to have a good code for it. But I always use my own code, and it's not that so much difficult for me to develop a code. So you can search, for example, how we can advanced search on Scopus and PubMed, and then you have your own keyword and you develop code, and you can retrieve all of the relevant papers. Then you can extract them to, for example, CVS format or another formats, and then you start screening them. Sometimes you need a statisticians. It depends if you want to, if you know that after the systematic review, we will have some quantitative reports and quantitative synthesis. Then we can put this data into the software. For example, S-Data is the well-known software for doing a meta-analysis. Then you will need for someone help you for the meta-analysis. And sometimes we need for health economics. Health economics, if the topic's related to the cost effectiveness, then we need like this. Or sometimes we trying to do a systematic review on qualitative research, then we need a relevant expert. So I would say that we need a relevant expert on the topic, and also someone can help us for the systematic for the topic, and for the searching as well. But also we need someone to do search independently and blind. We do always two researchers, and I always assign two researchers to do researching with the keyword, and then I always try to screen them independently as well, because in that case, if there is some disparities, then they can discuss with me as a gold standard, or someone like who is responsible for research and who is expert in that area, and then we can come to agreement and then include or exclude that study. So this will help for minimize the bias and error. Otherwise, if I want to just only assign one researcher to do that, it will be very difficult, because in that case, the search won't be systematically, and maybe someone will be not that good in screening, and it will be a personal view mix, and it won't be a good screening and extraction. Also, it's important to know that we also need 2% to measure quality of studies. This could be done by experts in quality studies. I mean, experts who are good in methodology. I mean, they need to know if the study is good, and there is no any clear flow in a study, if RCT has done in a strong way, if randomization in an acceptable way, if sample size is enough or not. So lots of questions that you cannot answer by yourself. So you need 2%, two experts in that area, then do it independently, and then like search, they should come to agreement and discuss, and then with, if the argument cannot be solved, a gold standard and someone can be involved, and then we can finish and assess the quality. We have lots of checklists for it. For example, we always use F-stroke checklist, NOS checklist, it's nothing home checklist, for example, for assessing systematic quality of the study and risk of bias. So, of course, we have in the slide and PowerPoint as well. But it's needed for two other person to do it blind and independently, and then have a session together. And also, beside the research group, review group, we need an advisory group. Advisory group is those will use your outcome and your result. It's important because you need to have someone to sell your idea and sell your systematic review to them. Otherwise, it won't work. For example, healthcare professional may need it. If you see sometimes physicians try to search on internet to find what is the best evidence-based today. So maybe they can use it. Maybe patient can use it. Could be advisor group, service users, and expert in a research method. So you can have them in another group, like advisor group. In that case, you will make sure that your questions for doing a systematic review will be very good and strong, and your question will be answerable and will be very successful in the outcome. So now I want to find what is a systematic review. Systematic review is attempts and try to collect all evidence available, and that evidence are primary studies, and then based on a pre-specified questions, we include, and of course, eligibility, inclusion and exclusion criteria, we include them, and based on a minimum bias, we try to combine them and also report them and apprise them. And then results will be reliable. I have defined this to you before, but it's official definition of Pakpour as well. So, as I told you, characters of a systematic review is starting with the need of systematic review, then we'll go for if the systematic review has a good question, an answerable question, and then we can continue with it. So then we will make sure that our systematic review in a good way, and we can monitor it. So based on pyramid of sciences and studies, and you can see that systematic review and meta-analysis are the most powerful studies and with very low bias. We have several types of classic systematic review. Systematic review could be descriptive or prevalence, could be relational, causational and observational, could be interventional study, and could be diagnostic study. And for the prevalence, we consider, for example, prevalence of burnout among physicians. There are descriptive, systematic review of worldwide epidemiology of psoriasis, could be also descriptive. And now we have relational, causational, observational systematic review, internet addiction and sleep problems, systematic review and meta-analysis, association. But so for the relational and causational observational systematic review, we test association between two topics like physical burnout, patient safety, and patient satisfaction, for example. So for, or maybe internet addiction is the problem, nurse staffing, and omission in nursing care. for interventional study, normally we use RCTs because RCT, as I showed you in the pyramid, RCT is the most powerful interventional studies. So most researchers try to highlight randomized trials in the topic, in the title, to show that we have included only the most powerful studies. Then you will make sure that the result is the most reliable and should be very important. So, for example, using medical masks versus N95 respirators for preventive COVID-19. So it's like a systematic meta-analysis of RCTs, or probiotic and depression, the effect of probiotic and depression. It's also a systematic meta-analysis of RCTs. So it's important to be highlighted on the topic to show that we included high quality studies. And also the last category and type of the classic RCTs are diagnostic RCT. It's like diagnosis for tests and prognosis, and would be used for clinical and laboratory. You can also use this type of systematic review for reporting the accuracy and the power of tests, for example, if serological tests is good enough or not. For example, for the COVID, we found that PCR is not always, of course, it's a gold standard, but it's not always successful. For new variants, it has like of 40% of false negative. So, I mean, based on systematic review, we found that clinical and clinicians and physicians are now more careful with reading and ordering PCR for the COVID, suspicious COVID people. So based on this, you can decide. For doing systematic and conducting systematic review, we need 10 steps, and you can start gradually to do that. So please make sure that these steps are very important, and you need to check everything, and you should go gradually. You shouldn't be in a hurry, just only going to search. No, you should start with, first you should start with question. If a question is clear and your question is good enough for searching, and then second one could be a preliminary search to do that, and then you can define and formulate the problems, going to the inclusion and exclusion criteria, writing protocol, and publishing and submitting protocol for the Prospero, because in the Prospero, when you submit, someone review it and comment on it. It's like a publication protocol. But of course, it's not like a papers. But it could be searchable, and you can publish your search, of course, in some journal like BMJ, Open, or other BMC systematic review your protocol in the details. But you should report brief protocol and provide your registration number. It's like RCT. In that case, it will help other researchers to know and to be updated on ongoing research. So one of the steps is submitting and publication the protocol of the systematic review. So the first step, determining the scope of the review. We have two scope of the review. The first scope is that, of course, we need to develop a scope. What is the scope? What is the question? Of course, it needed your knowledge and your experience and your discussion. Then if you know what will be the scope, you can decide which scope could be needed. We have two scopes, broad versus narrow. For broad, it's sometimes good have advantage and disadvantage. If you select advantage, if you select broad, you can have a comprehensive, and you are make sure that you have lots of studies and publications, and you can search within and find your own specific area. But disadvantage is that because it's very broad, and then it's needed lots of data collection, needed to screen lots of studies, and needed lots of several people to do that, and makes more time and maybe more money. So it's not always perfect. And also for narrow scope, no, you have very specific question, but the problem is that it will be, of course, it will be advantage if you have a very specific, you will be too narrow and you will find, for example, 10 papers or 20 papers rather than 100 or 1000 papers. But the problem will be that the number of the paper won't be enough for you to go through and search and screen them, and some of them may be controversial, and you cannot make a good decision based on it. So you will need it to maybe to increase your scope and expand your scope to have more studies. So too narrow and too broad is not that good, and you should decide between them and to include the studies. Sometimes you start with one question and you finish with several questions. I mean, when you expand your scope, you finish your studies with several publications, several systematic, because, for example, you find that several interesting outcomes as well, and you can report it in a separate systematic, but you please make sure that it shouldn't be a definition of salami. They shouldn't be interrelated, and they are maybe, for example, physiological, psychological, treatment. In that case, you can report in a different way. But I mean, it's important to see a broad, but a different view can help you to understand the situation. If you want to start with searching and the topic and scope, I suggest that and recommend that you use FINER criteria. For FINER, it's the scope and topic should be feasible, interesting, novel, ethical, and relevant. Feasible review, you need to know that if a question could be addressable and you can have an answer for it, and you can find a number of papers but manageable. I mean, for example, 2000 papers. But if you want to expand it and have a very broad question about what is the effect of light on, for example, depression, maybe it will be around, I don't know, about maybe 10,000 papers, and then it won't be manageable, and you need to be narrow and specific question. So we should have a feasible review, and you know that two people will review the extracted search, so they cannot review 10,000 papers from each database. It takes maybe some years to do that. So it's important to manage it in a good way. So could be a feasible way. Of course, I understand that sometimes we cannot find answer for all of our questions across literature. So in that case, we can put it as a limitation of the systematic review and report it and say that despite that this study reported some effectiveness, but none of them reported effectiveness on this specific outcome, and future studies should do that. So I mean, you can do like this. And the next criteria would be interesting to you. For me, interesting defines as a topic and hot topic. If the number of publication is increasing in the specific area, for example, if your country or your continent or world are facing a specific problems like COVID, climate change, or health disparities, whatever, it will be an interesting topic. And then you can go through it and try to find an interesting question, and of course it could be addressable and answerable. And it could be novel. And as I told you, you can go to Prospero, PubMed, and other databases to find that if your review is unique or it's repeat like before. So novelty is not just only the topic, but also the methodology. And you should try to have a good quality and high quality methodology for your systematic review. And as I told you, you can search and see what have done on Prospero, and it's always important. Some journals, like review journals, they call it review, for example, Sleep Medicine Review and other journals, they ask you to provide a Prospero registry. So it's important for yourself also report and submit and report the Prospero registration number. And also your review should be relevant, and of course the relevant comes from a stakeholder and comes from those who are into the topic and expert in the topic. So these two groups can help you to provide a relevant review and of course an important good topic for answering a good question. So if you want to find a relevant review criteria, you can go for grade framework. A grade framework is a grade of recommendations, assessment, development, and evaluation. You can Google it, and it's reported in a BMJ, so you can find it. And it could be a good framework for developing and presenting a systematic review approach. It's like a guideline to find a relevant review and report it. So it's also important. The second step could be formulate the problem. I mean, now we know, now in the first step, we know the title, for example, internet addiction and the problems. So we know the question, what is the prevalence or what is the connection between internet addiction and sleep problems? And then the objective could be to find out the connection and what is the strength of the connection and what is the prevalence of insomnia across internet addiction. This is just an example to know. Now we want to formulate the problem in a better way to understand how we can go for it. So for the formulate, we should know that if these questions and if the answer can help us to fill the gap in the knowledge. If, for example, say that 30% of the adolescents suffer from insomnia, of course, addicted adolescents to the internet, though, and then maybe you can contribute to the literature. So the answer is very important here. And if your answer can help you for this, then you can formulate a good question. So for good question, if we have a good question, in that case, we will have a good answer, but not only answer. This question will help us on several places, like eligibility criteria. As I told you, we will focus on addicted population, those suffer from insomnia, and it will be criteria, for example, just only age range will be adolescents, and could be helpful for searching for studies. It will be not randomized study, it will be observational study, for example, and which data we will need it. From the question, we will need data from insomnia, percent of the insomnia, age range, gender, for example, and also mean age. I mean, we can understand from the question how much data we will need for this type of the questions, and how can we try to understand from the questions. For formulating systematic review questions, we have different style. We call it PICO, it's an abbreviation, PICO, PECO, POLIS, and they can be used in different types of studies. And I thought with the PICO or PICOs, for example, S means systematic review. PICO is abbreviation of P, population, I, intervention, C, control group, and O, outcome, and S, study, design, and also systematic review. So for PICO, it's important to know that, for example, what is the population? I mean, which will be the target population, which type of intervention we will need it. If no intervention, we can have an observational, so it's not needed exact intervention. And what is the control group? If we have an observational case control study, what will be the outcome? We will need it to define a real outcome and how we can measure the outcome. And a study design could be how we can, how we want to design and how we want to include the study. I mean, just only observational study or intervention. And PICO elements help us to shape objectively of the study, for example, from the clinical perspective. And if the objective is to measure clinical effectiveness of a treatment for childhood retinoblastoma, then we will participant. Will be those, of course, published studies with participants diagnosed with retinoblastoma at childhood age. I mean, 0-18 years, and then we will have intervention. It will be a treatment. Should be a combination of treatment with retinoblastoma, surgical, non-surgical, thermotherapy, pharmacotherapy, chemotherapy, radiotherapy, and other type of therapy, and we can compare and we can see which type of intervention reported. And outcome could be survival, progression-free survival, tumor response, or adverse effect or side effect. So I mean, outcome could be whatever we want to search it and want to find it, but it's needed to have two important questions for the outcome. First, what is the outcome? Second, how we can measure the outcome. And because so many different measures could be self-reported, clinical outcome, or objective or subjective measures. It's important to know that. But you cannot mix objective with subjective measures. You can report separately, or if there are so many subjective, you can omit objective and just only report subjective. It depends on the publications and reporting. And the study design could be randomized control trial. And I've used, if you remember, I told that RCTs are very important and powerful. And if you focus on RCT, your publication, your systematic review will be more powerful because you just only focused on the RCT. As you know, that randomization is very good, but sometimes we don't have randomization, just only before and after trial or non-randomized clinical trial. In that case, you can include or not include, but you cannot combine in a good way with RCTs. You can report RCTs or without RCTs, non-RCTs separately to combine. But if few non-RCT, in that case, you can omit them and focus on RCT. It depends on how you want to define eligibility of the study for inclusion. So sometimes test series would be interesting, sometimes not, but for treatment, RCT could be the best. The next criteria to formulate our systematic review question is PECO or PECO. S is study design. P is population, E exposure, C control group, and O outcome. As you can see, this could be used for environmental and ecological systematic review. For example, to see association between air pollution and mental health. This is just example. So for association between air pollution, what is the population? For example, population could be general population. What is exposure? Those who are living in a very polluted cities, metropolitan, and those who are not living in the metropolitan. This could be as a control group. And the outcome could be mental health, how you can define mental health, and how they have reported the mental health. For example, if they have reported based on subjective or based on interview with the psychiatrist. It depends. And if you develop a good way, and if you are lucky, or if you want to be very good, you can only report those who have had reported with clinical interview with psychiatrists. In that case, the result will be much more powerful and reliable and good. But sometimes there is no such a possibility, and then we have to keep with self-reported measures like hospital anxiety, depression, general health questionnaire, whatever we have done. And this is also example to see that, for example, ecological impact of on the population. For example, P could be industrial workers, because some of you, maybe you are occupational therapy students. This could be interesting for you to use PECO for systematic review. Occupational noise exposure lower than 80 decibel versus occupational noise exposure higher than 80 decibel could be exposure in the control group, and the outcome could be hearing impairment. Another example could be for general population, and then see traffic noises which affect general population, and you can see, for example, hearing impairment, or maybe mental health, anxiety, blood pressure. So will be very important. It helps much more to shape and formulate your question, and then objective, and then your inclusion, exclusion criteria. Everything will be after your question, and you should be very careful about it. And policy is could be in a way epidemiological systematic review. It's like P population or participant, O outcome could be disease, event, practice, L location. For example, if we'll be in the China, Taiwan, Asia, worldwide, and I means indicator, I mean, do you want to measure and assess? It could be prevalence, incidence, frequency, mean. It's like a descriptive and epidemiological study design. Of course, when you are trying to measure prevalence, study design will be only cross-sectional. So it depends which one. But police could be used for epidemiological studies. And epidemiological study, you know that 3 indicators needed, for example, time, person, and place. So you can see that we are all have like this. In the indicators, we have a time, L could be location, person could be the population. So we have all of them in the police. So you can see that. We have also another one, CIAO, CIAO. CIAO could be clinical and health services systematic review. If you want to do something like this, you can use CIAO. C is clients, could be patients, could be healthcare providers, could be general population, of course, but receiving services. I could be intervention. A could be alternative intervention if we have some parallel intervention as a comparators, and we can compare them. And outcome could be some whatever we are. For example, outcome could be patient satisfaction, understanding, or patients or people's health literacy, healthcare workers literacy, whatever. For example, educational intervention to improve people's understanding of key concepts, assessing effects of health intervention. So it's like intervention for clients for the intervention. So it could be good for you to understand that this is very important. And then if we want to use this for the healthcare system, we can use this formulation for this, and we can formulate or question based on it and use it. Third step could be defining inclusion criteria. It's very important. Now we have topic, we have a question, we have formulate or question and topic and scope. Now we need to define inclusion and, of course, exclusion criteria. We should know that it depends how much you want to be precise and how you want to proceed. But it comes from your topic and your formulation. So if, for example, you are working with study design, a specific study design prevalence, so your inclusion criteria at least could be if we want to work on air pollution, mental health, general population in the topic and in the question. So we need here those paper reported general population and needed reported air pollution as exposure and also mental health as out. So you have this, and if it's association, they should need a reported association. Otherwise, if it's prevalence of mental health problem, they should report a prevalence. So now we know some things about inclusion criteria, but you can make it more complex and make it more precise. And in that case, you can use, for example, language as a boundary. For example, they should be just only English language or just only with high quality. For example, if they get based on a quality assessment stage, the score of 7, we include it. But sometimes I would include all of them and report their quality in a separate table and column. In that case, readers can understand that which study has low quality. But if you want, you can, of course, increase the quality of your systematic review and omit those with poor quality and include it in the inclusion criteria. Publication type is also important. For example, if you want to have a very specific, if we have some different definitions, then we need to define based on the publication range and time. For example, we only consider papers from 10 years ago because 10 years ago, we WHO defined addiction in a real and clinical way. So studies after this definition will be used. This help us to include more precise study. And of course, publication type, maybe if you want to just only report original article, those just not under review, because some databases like OSF reports under reviewed papers. Maybe you can exclude them. But from my perspective, under review studies are not that good. It was needed from emergency situation like COVID-19, but not now, because it's not reviewed. The quality is not that. It's not that 100% good. So from my perspective, it's not that interesting to include under review studies, but original studies with published one could be enough for that. And then it could be reported, and I just want to see, go through. Please note that and make sure that we shouldn't have too narrow inclusion criteria, because in that case we will miss several papers and we will miss the chance to include them. We should have the most important criteria rather than to be too narrow. Then we cannot generalize or result to all published and say that this, based on the publication so far, the prevalence of X could be like this. So, I mean, shouldn't be too narrow, and of course, shouldn't be too broad. In that case, you cannot compare your result. It's important to be in a real world. I think that we have just only around 25 minutes to finish the courses. I will have my speech within 5 minutes and then hear your question. And if you have some question, I will be happy to answer to them. For the language, you can include all languages. Sometimes from Chinese languages have published Scopus, and you can only focus and limit on Chinese language. And in that case, you can just only generalize your systematic review on Chinese populations, on Chinese countries, Chinese-speaking countries, not whole around, not worldwide. But you can decide. But if you want to include English, it's good. It's worldwide, it's international, but of course, it's not whole story, and sometimes we miss some other languages. But English is normal for the language, and I also use this. And there's step 4 to 6 will be protocol writing, testing, and registering. Writing protocol could be from a researcher version, and then you submit your protocol to the Prof, and then they review it. It will be registration version, and then you do it real systematic review. It will be publication. Then you can use it. And for the protocol, you should start with background, review question, and define inclusion criteria or exclusion criteria, and research evidence, which study will be selected, data extraction, which data extraction you will use, for example, those reported with title or abstract, for example. It's normal for the data extraction or study selection, of course, title and abstract of all article based on reviewing databases could be used, and quality assessment or how you want to assess quality, who will assess the quality of the study, of course, two of them, and search if it's also another 2 person, and how you can synthesize the data, and how you want to disseminate and publish your protocol. So this is the framework of your protocol, can be used in the process. Of course, there are some steps I think that you can use and you can see, but because of time limited, I think that I can finish for now and wait. If you have any question, I will be very happy to answer. Thank you so much for your time and for your great participation and involvement in this session.
Yes, thanks, Amir, to giving this very important information about the systematic review. And let us know about the different types of the reviews and what the procedures we can do for the systematic review and this kind of guidelines for our students. So may I know if any participants here have any questions that you want to ask Emma regarding the systematic review? If you think that you are not able to voice out via the audio, then you can use our chat room. Okay, you can use our chat room to type what you want to ask, and I will check with your chat room and to see if you have anything you want to ask Emma regarding the questions. Did not see anyone. Maybe a little bit shy and still digesting the materials. Oh, yes, we come a question from Wickham. Okay, she asked, can you explain again the difference? Wait a moment. I need to see. Okay. Can you explain again the difference of study design and publication status in inclusion criteria?
Thank you so much for this question. Regarding study design, when you want to do a systematic review, it depends on your title. If your title talks about prevalence, study design will be those studies with cross-sectional design. So you should limit it. So you just only go for cross-sectional study in the design. Then it's automatically could be included in the inclusion criteria. Those paper with reported prevalence and cross-sectional study design. So they are, of course, correlated and intercorrelated together. And when you want to, for example, see the prevalence of insomnia, so you need to search papers with cross-sectional design, and you will have inclusion criteria as a observational cross-sectional studies.
Okay, so Suika, get it? Or okay, great. Okay, so do we have other questions from the participants? Well, we are waiting for more questions and let the participants to digest what they have heard today. Actually, I have a question. From your past practice, what is the timeline that you will use to make a systematic review? I mean, you will use how much time for, to search the database, and then how much time to extract the information, and how much time to try to, synthesize the information and make them into tables, something like that.
Thank you so much, Chong, for this question. And this is a very important question, of course. I think that I spend a lot of times for the scope and time for the topic. Maybe 2 or 3 months to understand which questions needed and what is the lack across literature. And I think that the 2 or 3 months take me to understand which systematic review needed. Then it takes me 1 month for me to formulate it. For example, define population, intervention, study design, and outcome. And in that time, I mean, within the 1 month, I developed the code for search. It takes me around 1 or 2 days for code text and extract it. And I record the time, for example, from the beginning to, for example, today. I should know it and write it, and then search for all of the databases in 1 day could be better. Then you can extract them. For screening time, it takes around 2 months, because I assign it to one person, another person also, and we do it together, and blinding and screening, and of course, delete the application. And then we should register and record how much we extracted from Scopus, Web of Science, and then we will have the 100 papers, for example. And it will take 1 month extra to extract from tables and results of the papers. And then it takes around 1 or 2 months to synthesize them, and 1 month for the meta-analysis. I would say that it takes from 4 to 6 months minimum.
Yes, so it is not that easy.
No, but it's not that difficult. The most important and the difficult part is that the first step to know how you can contribute to the literature. Otherwise, it won't be a successful review, and no one will buy you your result, of course.
Yeah, I agree. The novel idea and that can take care of the literature gap is the most important thing.
Yeah, exactly.
Okay, may I know if any participants have other questions that you want to ask? Okay. I think because it is the time in Taiwan is during dinner time. So I think
the students want to go
for we're not having the energy now. So
yeah, I feel
okay. Yes, but anyway, I believe that if any participants have following questions, I think that Emma will be welcome you if you email him to ask the questions. I know he is a very, very busy man, but I believe that he will try his best to respond you.
Yeah,
Yes.
exactly. For sure.
Yes. Yes. And I believe that the PowerPoint provided by Emma is very informative for us to know about all the systematic review. Oh, I think there's another question. Sorry. So Emma, we need to take you longer. Okay. Here is from Dr. Duan. He asked, is there any scale you recommend when doing quality assessment of the included studies? Can we simply use JAD-AD scale or risk of bias graph? Or is there other scales you recommend? Thank you.
Yes, you can use this, but I think that you can use more reliable scales like Newcastle Ottawa Quality Assessment Scale. It could be more powerful and it could be more reliable for quality assessment. And I prefer and recommend to use NOS.
Okay. Thank you. So I think we will not disturb our dinner time. And of course, Emma, at your time, I think it will be towards lunch, right?
Yeah, yes, exactly.
Okay. And before we end this this talk, may I invite everybody to show up your video and then have a camera capture with Professor Pakpour. We may need wait for a moment. Some people are trying to turn on their camera. Okay, great. I think Kaija, may we have one more? Okay. Okay, thank you. Yes, our teaching assistant has already captured the video. Thank you for the participation, and I hope that today's talk can give you more information and more knowledge about systematic review. And hope that we will have more collaboration with Professor Pakpour in the future. And Kaija, can you help me to show up the next next talk that we will hold?
Okay.
Okay. So at the end of the talk, I want to disseminate that the AHS, that the Institute of Allied Health Sciences, will have another cross-disciplinary forum, and the presenter will be Dr. Chiwen Huang from the Hong Kong City University of Hong Kong, and then she will give a topic about brain sciences and linguistic cognition for the elderly. So if you're interested in this presentation, then you can go to our website and then to book your time and then enjoy the talk. Okay, Emma, if you're interested, you can still join. But yeah. I know you're busy. Yes, okay. So thank you all again. and have a great time for enjoying your dinner or lunch. Okay,
Thanks.
see you.
Thank you.
Yes.
Bye.
Bye.